this recent study that came out that showed how certain jobs are really seen as stressful for women or perceived to be that way, and then that there's this relationship with increased risk of cardiovascular disease associated with these jobs. A really challenging question is, what could we do to reduce this risk? So certain occupations can be more stressful for men versus women. And so when we think of people who are nursing or providing home care, health care, these are known to be very stressful positions. Yet this recent study found that men and women are maybe perceiving this stress differently, and that the risk of cardiovascular disease is higher in women than men doing exactly the same job. So then you get into really gender differences. So we know that there are biological sex differences, that the stress hormones are different for even exactly the same kind of acute stress or chronic stress in men and women. But then you have gender is talking about the social, cultural effects as well. And those are even less well studied, I would say. The bottom line is that we definitely know biologically there is a difference between how men and women respond to stress, even exactly the same stressful event. And when you have different types of work that men and women are doing, that if they feel that this is a stressful type of work, how that affects women's bodies will be quite different. So it's known that stress is an important risk factor for cardiovascular disease. And although this area is really kind of understudied, we do know that there are really important differences in how stress affects our body, and it really differences by sex. Regardless of what the initiator of the stress is, we know that men and women respond to stress differently. The actual chemicals that are released, glucocorticoid levels, are different. Those levels are different by men and women. I think understanding yourself and what gives you stress, being really sensitive to that, and then changing what you're doing to reduce your stress, get away from your stress, or take care of yourself. You know, if you need that life-work balance where you're getting the kind of therapy you need to relax and reduce your stress when you're not working. If that works and you can keep your stress down, the key is keep your stress down, because it not only increases cardiovascular disease, it increases autoimmune diseases, which are the top diseases in women also next to cardiovascular disease. It's a high risk factor for increasing chronic disease in women. And so you want to make sure that you're getting that stress down in your work and in your life.